where you are? And can you tell me what today is? And do you know what time it is? Patient is experiencing no pain, no grimacing, does not appear to be in any distress. Patient is oriented to person, place, and time. Facial features are symmetric. Can you look at my hand right here and tell me how many fingers I'm holding up? 2. Patient was able to recognize 2 fingers, hearing intact and vision intact. All right, I'm going to just place my hands on your face, down your neck, and then down your arms just to feel up your temperature. Can you go ahead and squeeze my fingers for me, please? Thank you. Patient skin is warm, dry, intact, no lesions noted. Patient skin color is light tan pink. No cyanosis is noted at this time. Patient hand grasps were equal bilaterally. Radial pulses were present, regular, and pulses were 2+. So right now I'm going to go ahead and look inside your mouth. If you could open up your mouth for me, please. I'm just going to use my pen light to look inside there. And go ahead and stick out your tongue. Thank you, and just lift your tongue just briefly. Thank you. Oral mucosa is pink, moist, no lesions noted. Regular dental caries have been corrected. All right. Well, what I'm going to do now is I'm going to recognize the landmarks on your chest that I'm going to listen to with my stethoscope to do an assessment of your heart. So I'm just going to loosen up your gown up here at the neck and move it slightly out of my way. The first landmark that I'm going to note is the aortic, which is the second intercostal space down on the right sternal border. The next landmark is the pulmonic, which is the second intercostal space on the left sternal border. The next landmark is herbs, which is the third intercostal space on the left sternal border. The next landmark is the tricuspid, which is the fourth intercostal space on the left sternal border. The next landmark is the mitral, which is the fifth intercostal space on the midclavicular line. So if you could raise your gown up for me, please, just to your stomach. All right, I'm going to use my stethoscope to listen to all of those landmarks noted. First, I'm going to use the diaphragm. Now I'm going to listen with my bell. Heart rate rhythm was regular, no extra heart sounds heard. S1 was heard loudest at the apex, S2 was heard loudest at the base. The next thing I'm going to do is I'm going to listen to your lung sounds. So I'm just going to place the stethoscope in different places, and each time I'm going to ask you to take a deep breath in and then breathe out through your nose. If you get tired or dizzy at any time, we can take a break, and we can restart whenever you're ready. So I'm going to sit your bed up, and while I'm doing that, if you could go ahead and place one finger on one nostril and place it on the other one. Patient's nares are patent bilaterally. Are you comfortable? Okay. I'm going to put it over your head, please. Thank you. Big breath, please. And one more. Thank you. If you could lean forward from here, please. I'm going to listen to your back. Big breath, please. Again. Again. You feeling okay? Again. We just have two more, okay? Again, please. And last time. Great job. Okay, thank you so much. Breath sounds clear to auscultation, anterior and posteriorly and laterally. No adventitious sounds heard. All right, the next thing I'm going to do is I'm just going to check your arms, your elbows, your joints, those type of things. I'm going to place my hand underneath your elbow joint, feeling for redness or crepitus. I'm just going to bend your arm close to you and then away. Any pain? Just rotate your wrist this way. All right, we'll do the other side. Any pain? Thank you. Passive range of motion, no swelling, warmth, or crepitus felt in the joint, no pain reported. If you could place your arms up like this for me, please. You can extend your arms in front of you and then bend them back this way. Thank you. All right, and if you'll put them up just like this, I feel pull against my hands and then press against my hands. Good job. All right, you can put your hands down. Patient's active range of motion was full. She had equal muscle strength bilaterally on her upper extremities with a grade of 5. All right, I'm going to feel the skin of your legs and then check some pulses on your feet and some different things down here, and we're almost finished. You're still doing okay? Okay. Let me go ahead and slip your socks off. All right, I'm just going to feel of your skin from your mid-thighs down. Her skin is warm to touch, getting cooler towards the feet. Her skin color is light tan pink. No lesions noted, no cyanosis, no change in skin color on her lower extremities. I'm going to assess her dorsalis, her posterior tibial pulse, present bilaterally, equal with a 2+. I'm going to check her capillary refill of all 10 toes. She has nail polish on, so I'm going to do it at the tips of her toes. All right, and I'm going to assess for edema. And no edema noted. Before I forget, can I go ahead and see your fingers? I'm just going to check the capillary refill of all 10 of your fingers. There is no nail polish, so I can go ahead and depress the nail bed. Thank you so much. All right, if you will go ahead and swing your legs over to the side, we're going to do some range of motion exercises or assessment on your lower legs. I'm going to place my hand on your knee and do an extension of your leg. So if you can go ahead and extend your leg and then bend it back. And for video purposes, you walk around the bed and sit on the other side? Because they can't see you doing this. Thanks. Are we good? All right, so I'm going to place my hand on your knee and extend your leg fully. And then bend it back, thank you. And let's do the other side. Thank you. No redness, warmth, or crepitus noted during passive range of motion of both of your lower extremities. Now, if you could pull against my hands and then press against my hands. Muscle strength was equal bilaterally of her lower extremities with a muscle grade of 5. Now we'll go ahead and stand you up and check for flexion of one leg at a time. Thank you. Other side. Thank you. All right, you may have a seat. Patient has full range of motion of both lower extremities bilaterally with no reports of pain. We'll go ahead and help you back into bed. And we'll get your, I'm going to lay your head down because I have forgotten to check your abdomen. So let me lay you down really quickly, and I'm so sorry for this. And then we'll get your call light, put your bed in the lowest position. We'll get your 2 side bells up. And obviously by the drawn curtain, we already have privacy. All right. You'll just raise your down just a little bit. I am so sorry about that order today, ma'am. I hope you can understand as a student. Sometimes it's hard to get it all up here, and even as a 20-year nurse. I'm going to go ahead and listen to your abdomen, starting in the right lower quadrant. All right, style sounds are active in all 4 quadrants. No guarding noted upon assessment. And one last question before we begin our day together. Do you have any allergies to medications? No allergies. All right. Well. As I walked into the room, your imaginary IV over here was checked, and your physician's orders were checked, and we made sure that we had everything in place for you to have a wonderful day here at our pretend hospital. Do you need anything else from me? Your call light is in place, your side bells are up, your bed is in the lowest position.